Hi all, welcome to Physio Exam Buddy. This video is related to determinants of blood pressure. By watching this video, you will be able to answer define arterial blood pressure, define pulse pressure, define mean arterial pressure, and describe the determinants of blood pressure. Out of this, the first three can be asked as a one-mark question in theory, whereas the determinants of blood pressure can be asked as a short note or as a sub-question if the essay is on hypertension or arterial blood pressure. Both these things, that is the definition as well as the description of the determinants of blood pressure, can be asked for your viva in the practical exams also. So first about the definition of arterial P2. It is the lateral pressure exerted by the column of the blood on the vessel wall. You know that in a blood vessel, the blood flows in a forward direction. During this flow, this column of the blood will exert some lateral pressure, which is exerted on the walls of the vessel wall. So the lateral pressure, which is exerted by this column of blood on the vessel wall, it is known as the arterial blood pressure. And it is expressed as systolic divided by diastolic blood pressure, that is systolic by diastolic BP, and the unit of blood pressure is millimeters of mercury. And what is this systolic BP? You have to explain that it is the maximum pressure during the systolic phase of the cardiac cycle, and the value lies between 100 to 140 millimeters of mercury in case of systolic BP. Whereas diastolic BP, it is the minimum pressure during the diastole, and the normal value lies between 60 to 90 millimeters of mercury. Please keep in mind, it is the maximum pressure in case of systolic blood pressure, whereas it is minimum pressure in case of diastolic blood pressure. Next, about the pulse pressure. It is just the difference between systolic and diastolic BP. So if a person have a systolic blood pressure of 120 millimeters and diastolic blood pressure of 80 millimeters of mercury, then his pulse pressure will be systolic BP minus diastolic BP, that is 120 minus 80, which is equal to 40 millimeters of mercury. Next, about the mean arterial pressure. It is the average pressure throughout the cardiac cycle, but it is not the algebraic mean of systolic and diastolic BP, since the duration of systole is shorter than the duration of the diastole. So the formula for calculating mean arterial pressure is diastolic BP plus 1/3 of the pulse pressure, and the normal value lies between 90 to 100 millimeters of mercury, and this can be asked as a calculation type question for your practicals also. So if the values of systolic and diastolic BP are given, first calculate the pulse pressure, then substitute in this formula for getting the value of the mean arterial pressure. Next, about the determinants of blood pressure. Arterial blood pressure, it is a function of the product of cardiac output and total peripheral resistance. That is, BP is equal to cardiac output multiplied by peripheral resistance. Therefore, arterial BP is affected by conditions which affect either cardiac output or peripheral resistance. Cardiac output is the main determinant of systolic BP, whereas the total peripheral resistance is the main determinant of diastolic BP. So, factors cardiac output like stroke volume as well as heart rate will determine the systolic BP, whereas the factors affecting the diameter of the arterioles will affect the total peripheral resistance and thereby the diastolic blood pressure. So the main determinants of arterial blood pressure are cardiac output, which determines our systolic BP, and second one is the peripheral resistance, which determine the diastolic blood pressure. Now we will see about the first determinant, that is the cardiac output, which is the main determinant of systolic BP. Cardiac output, it is governed by factors influencing stroke volume as well as the factors influencing heart rate. So all the factors which affect the stroke volume and all the factors which affect the heart rate will affect the systolic blood pressure. So the explanation of this cardiac output and the factors affecting stroke volume and factors affecting heart rate have been given in our cardiac output video, which is already posted in the Physio Exam Buddy channel. So you have to first describe the factors affecting stroke volume and then the factors affecting heart. So please watch our cardiac output video in the Physio Exam Buddy channel. So after completing the cardiac output, which is the main determinant of the systolic BP, you have to go to the second determinant of the cardiac output, that is the peripheral resistance, which is the main determinant of the diastolic BP. Before going in detail about the peripheral resistance, the main thing you have to write is that the chief site of peripheral resistance is arterioles. We have many type of blood vessels like arteries, arterioles, veins and capillaries. Out of this, the arterioles is the chief site of peripheral resistance. And from Poiseuille's law, it states that flow, which is represented by Q, it is equal to pressure by resistance. So by rearranging, we will get R is equal to P by Q, which is equal to 8 eta L by pi R raised to 4. So R is the peripheral resistance and eta is the viscosity. Capital L is the length of the blood vessel and small r is the radius of the arterioles. So peripheral resistance mainly depends upon the viscosity, which is eta, length of the tube, which is represented by capital L, and radius of the vessels or the arterioles, which are the main site of the peripheral resistance, represented by small r. So since the length of the blood vessel in an intact body is the same, the L, that is the capital L, which is present in the numerator, does not change. So the major factor that determine the peripheral resistance are radius of the vessel as well as the viscosity. Whereas the radius, it is inversely related to the peripheral resistance, and the viscosity of the blood, it is directly related with the peripheral resistance. So we have seen that in an intact body, the length of the blood vessels does not change. So the major factor that determine the resistance to the blood flow, the peripheral resistance, are radius of the vessels and viscosity. And these two factors, it is clear that the viscosity, it is directly related to peripheral resistance, whereas the radius of the blood vessel, which is present in the denominator, it is inversely related to the peripheral resistance. So whenever there is an increase in the viscosity, as it is in the numerator and directly related, it will increase the peripheral resistance, whereas the radius of the arterioles, it is inversely related to the peripheral resistance. So any factor which increases the radius of the arterioles will decrease the peripheral resistance. So first we will see what are the factors which determine the caliber of the vessels, that is the radius of the arterioles. So the caliber of the vessels is mainly determined by 4 factors which you can explain under 4 headings, that is neural factors, hormonal factors, local factors and endothelial products. So please keep in mind the formula for peripheral resistance also, 8 eta L by pi R raised to 4. And any factor which increases the radius will decrease the peripheral resistance. That is, if the radius is half, as in case of vasoconstriction, the peripheral resistance can increase by 16 times, as the peripheral resistance is inversely related to 4th power of the radius. First, we will see the neural factors which affect the caliber of the vessels. So, we have already seen that vasoconstriction is a condition in which our blood vessels will constrict, which will decrease the radius of the arterioles. As the radius and the peripheral resistance is inversely related, it will increase the peripheral resistance. So, vasodilatation can increase the radius and thereby decrease the peripheral resistance. So, any factor which causes vasoconstriction will increase the peripheral resistance, like stimulation of our sympathetic noradrenergic stimulation. That is, stimulation of sympathetic noradrenergic fibers to blood vessels will mediate vasoconstriction and thereby increase the peripheral resistance. And in most tissues, vasodilatation is produced by decreasing the rate of the tonic discharge in the vasoconstrictor nerves. So, in skeletal muscles, it can also be produced by activating the sympathetic cholinergic vasodilator system, and vasodilatation can increase the resistance and decrease the peripheral resistance. Next is the hormonal factors. Same here, the hormones which causes vasoconstriction will decrease the radius and increase the peripheral resistance, whereas the hormones which causes vasodilatation will increase the resistance and thereby decrease the peripheral resistance. So vasoconstriction is caused by hormones like angiotensin 2, norepinephrine, epinephrine, except in case of skeletal muscle and liver. Whereas in vasodilatation is caused by hormones like histamine, atrial natriuretic peptide or ANP, vasoactive intestinal peptide or VIP, and substance P. Next is about the endothelial products which causes vasoconstriction and vasodilatation. Vasoconstriction is caused by endothelin 1 and thromboxane E2, whereas vasodilatation is caused by nitric oxide kinins as well as prostacyclins. Next, about the local factors which causes vasoconstriction and vasodilatation. First one is autoregulation. Depending upon whether it is vasoconstriction or vasodilatation, it will affect the peripheral resistance. Next, about the amount of the vasodilator metabolites. If there is more amount of vasodilator metabolites, it causes vasodilatation and thereby decrease in the peripheral resistance. And if there is only less amount of vasodilator metabolites, it can increase the peripheral resistance. Then the local temperature of the area, that is whether it is heat or cold. Cold causes vasoconstriction, whereas heat causes vasodilatation. So peripheral resistance, from the formula, that is peripheral resistance is equal to pressure by flow, which is equal to 8 eta L by pi r raised to 4 according to Poisson's law. It is clear that the radius, it is inversely related to the peripheral resistance, and viscosity, it is directly related to the peripheral resistance. So the resistance to the blood flow, it is directly proportional to viscosity and inversely related to the peripheral resistance. So we have finished first with the factors affecting the radius of the vessel and thereby decreasing the peripheral or increasing the peripheral resistance depending upon the radius of the vessels. Now we are moving on to the next factor which affect the peripheral resistance, that is the viscosity of the blood. So viscosity, it actually got a direct relationship with the peripheral resistance. So first we will see what are the factors which is directly proportional to the viscosity and which will increase the peripheral resistance. So the viscosity is directly proportional to the hematocrit of the blood, resistance of the RBCs to deformation, like in conditions like hereditary spherocytosis where RBCs are rigid, there will be increase in viscosity. And whenever there is an increase in the concentration of the plasma proteins like immunoglobulins in the blood also, which will increase the viscosity and thereby peripheral resistance. Next is about the diameter of the vessel. When the diameter of the vessel is high, it will actually increases the viscosity and thereby increases the peripheral resistance. So we will see in detail how the diameter of the vessel will affect the viscosity. At high velocity, in a very large blood vessel, what happens is that the RBCs usually occupy the central axis where the flow rate is maximum, leaving the plasma at the periphery. Now, when the blood enters into the small blood vessels like capillaries, more and more amount of plasma will enter the small blood vessels, and only very small amount of RBCs which occupy the central axis will enter the small blood vessels. So it will cause actually a decrease in the hematocrit value and decrease in the viscosity when the diameter of the blood vessel is decreased, thereby decreasing the peripheral resistance. Now we will see what are the factors which is inversely related to the viscosity. So here any factor which decreases the viscosity will decrease the peripheral resistance, and any factor which increases the viscosity will increase the peripheral resistance. So the factors which are inversely related to the viscosity are temperature as well as the flow rate. So whenever the temperature increases, viscosity decreases, and vice versa. Again, whenever the flow rate increases, the viscosity decreases. So in short, we know that from the Poiseuille's formula, peripheral resistance is directly related to viscosity and inversely related to the radius of the arterioles. So any condition causing vasoconstriction as well as increase in viscosity will cause an increase in the peripheral resistance, and as peripheral resistance is the main determinant of the diastolic blood pressure, it can cause an increase in the diastolic blood pressure. So to summarize, arterial blood pressure, it is the product of cardiac output and total peripheral resistance. So cardiac output is the main determinant of systolic BP, and total peripheral resistance is the main determinant of diastolic BP. So any factor which affect the cardiac output like stroke volume and heart rate will determine the systolic BP, and any factor which affect the viscosity as well as the radius of the arterioles will affect the total peripheral resistance and thereby the diastolic blood pressure. Thank you for your patient listening, and keep on watching Physio Exam Buddy, which makes your physiology exams more easier.